How is cataract surgery performed? Well, prior to cataract surgery there is a measurement on the eye with a machine called an IOL master, which accurately assesses the curvature of the cornea and the distance between the front and the back of the eye. And with these two measurements, the lens that is required at the time of cataract surgery can be calculated with a great degree of accuracy. At the time of the surgery itself, the first thing that happens is that drops are instilled to enlarge the pupil and numb the surface of the eye, and this is usually performed in the day case area by the nursing staff. Following this, you are taken clothed into the anaesthetic room, where the anaesthetist will put more drops in to numb the surface of the eye, clean around the eye with iodine to make sure the area is as sterile as possible, and give an injection around the eye, not into the eye, with a subtenons technique, which is a blunt cannula infiltration and is relatively painless. If you are at all anxious about the surgery, then a bit of sedation can be given prior to the injection, or if you're very anxious or claustrophobic, we can perform surgery under general anaesthesia as a day case procedure, but most patients prefer local anaesthetic, again as a day case procedure. Following the numbing of the eye by the anaesthetist, you are moved into the operating theatre, where we will then clean once more around the eye with iodine, and then a drape is placed over the face but away from the face to create a tent with fresh air blowing underneath, and it's not particularly claustrophobic. The operated eye is kept open with a very fine wire speculum, and sometimes you can feel a little bit of pressure on the lid when the speculum is inserted, but again it's not painful. During the surgery, there are some noises that you can hear from the machine which is removing the cataract, and buzzing noises, and it's very variable as to what you actually see. You certainly don't see any detail. Sometimes the vision goes completely dark, sometimes you're aware of shapes, and sometimes you get interesting kaleidoscopic colour effects. The surgery itself takes approximately 15 to 20 minutes, and following this the drape is removed. Again, it can sometimes be a little bit uncomfortable because it's often well stuck to the skin as it's peeled away, and then a shield is placed over the eye for a couple of hours following surgery, and the eye does not need to be padded.